Welcome again, everyone, to our latest webinar on the what, why, and how of results chains. Um, I encourage you to use the same chat box in which you're introducing yourself to react or engage with anything that you hear about during the session. But if you have specific questions, you will see a Q&A box at the bottom. If you can't see the Q&A box, maybe click on the three dots which say more, and then you can navigate to the Q&A box. That helps us to pick up specific questions. We'll try our best to answer as much of those as possible throughout the session. Also flagging that we will be sharing a recording of this webinar with all the participants after, and this will also be available on our Swapcard platform. With that, I will just introduce our presenter for today. So we have Gareth Davies. He's a director of Tandem, a monitoring, evaluation, and learning consultancy specializing in private sector and market systems development. Since 2010, Gareth has supported and evaluated programs across Africa and Asia, covering a variety of sectors and thematic areas, including financial services, agriculture, business environment reform, and tourism. Gareth is a good friend of the DCED. He is a regular contributor with DCED as well as with the Beam Exchange. So we're truly grateful that he's here to share his insights on results chains. With that, as people come in, I will keep an eye out on the chat. I will hand things off to Gareth and we can get going.
Great. Thanks, Manip. And yeah, welcome everyone to this DCED webinar on results chains. So thanks very much for taking the time to join us. Yeah, and great to see so many people from all around the world. Yeah, great. So let me just give you a quick overview of the webinar. So we've organized it into three sections. So the first one will look at the basics. So what are results chains? Then we'll move on to why use results chains? What are they useful for? And then we'll get into the how-to of how to actually construct results chains. And within that, we'll look at some of the pitfalls and challenges that people encounter. And then we'll also present some new approaches to results chains in the last bit. So yeah, before we get started, it would just be great to hear from you all about how familiar you are with results chains. So Manib is going to share a poll, and we just want you to let us know, how familiar are you with results chains from one, I've never seen a results chain in my life, all the way through to five, I practically invented results chains. So just as people fill that in, just to share a little bit about my own results chain journey. So I joined a business environment reform program in Nigeria way back in 2012. It was my first experience of working in a development program. And on my very first day, I was asked to produce a results chain for the intervention they were doing with media houses, having never seen a results chain in my life. So I did a very quick Google and cobbled something together. So and I've been working with results chains ever since. So I guess I started as a 1 and maybe, am I a 5? Maybe a 4.5, I would say. Great. Manip, do you think we're ready to share the results? Okay. Oh, wow. Great. Okay. So we've got some few people completely new, but some people, a lot of people around the 4. So that's great. Yeah. So for those of you who are kind of in the 1, 2, 3, we'll definitely go through some of the basics on the results chain in the webinar. And for those of you who are more at the 4 or 5 level, hopefully you'll still find something useful. So particularly when we get into the bit about the challenges and the pitfalls, and also the new approaches as well. All right, fantastic. So I'll run through this quite quickly, this first section, because a lot of you do seem to be quite familiar with the basics. But just so very quickly on what are results chains. So in very simple terms, results chains illustrate the causal logic of an intervention or a project. So they set out the ultimate impact that you're trying to achieve, the set of activities that you're going to implement, and then there's a series of changes or results that provide a causal chain or a pathway from those activities through to the ultimate impact. They're called various things, also known as theory of change, impact logic, impact thesis, a logic model. So they're represented in a diagram of boxes and arrows. So you'll have boxes for your activities, boxes for the impact, boxes for the changes in between. They're connected by the arrows, showing the causal linkage from one box to the next. But they are not just a diagram, so they should be underpinned by a document that also describes the theory, assumptions, and evidence for each causal linkage. So we'll have a look at that in the next few slides. So yeah, here's just a very simple stylized example. So at the bottom, you have boxes for your activities. At the top, you'll have your ultimate impact. And then in the middle, you'll have a series of boxes that link your activities to the impact. Yeah, so results chains can be drawn at different levels. So you kind of have a hierarchy of results chains. So the highest level of aggregation is the program level results chain, so commonly referred to as the theory of change. Then at the next level down, some programs develop results chains summarizing their interventions in a given sector, or they might be organized around pillars and have a results chain for each pillar. Then at the next level, you have intervention results chains. So typically when people refer to results chains, they're talking about intervention level results chains. And the DCED standard also focuses on results chains at that level. And then the most granular level, some programs develop results chains for, say, individual market actors that they might be partnering with, for example. So those would be at the most granular level. So here's just some examples of actual results chains, what they look like for those people who answered one and have never seen one in their life. So this is a results chain for a fingerlings intervention in the fish sector. So this is taken from the DCED reader on results measurement, if you want to have a closer look at this. So you've got activities at the bottom, things like private company assisted in developing a training module for fingerling traders. Then at the very top, you've got the various impacts that you want to see. So more employment, more income, more nutrition for customers, and then the various boxes in between that show the pathway. So, and I won't talk through all of that. But yeah, you can have a closer look in that paper. And yeah, we should say that we're going to email the slide deck to everyone afterwards as well, so you can take a look. Here's another results chain. This one for an artificial insemination intervention in the livestock sector. So yeah, don't worry if you can't read it. So I just included it really just at this stage to illustrate that results chains can vary significantly in terms of the level of detail and the number of boxes. So even though this one is a similar intervention to the previous example on the previous slide, this results chain has 39 boxes versus 15 on the previous slide. So we'll come back to this point on, simplicity versus complexity in the last section. Finally, here's an example of sector level results chains if people have never seen one of these before. So the results chain provides a kind of high level overview of 4 different interventions that the program was delivering in the maize sector. And it kind of shows at a high level kind of the main changes they were aiming for and how it all comes together. So, for example, they had an intervention around public-private collaboration, around hybrid seeds, and so on. So this gives a kind of overview of what they were doing in the sector. All right, so yeah, so we said that a results chain is not just a diagram. and that it should be underpinned by a document describing the theory, assumptions, and evidence for each causal linkage. So let's just look at what that looks like. So let's say we've got these two boxes in our results chain, X and Y. So the results chain is positing a causal relationship between X and Y. That's what that diagram says. So it's saying if X happens, then Y happens. So in an attached document somewhere, the program should then describe the theory that explains how X is expected to lead to Y. So some people also call this the contribution hypothesis or the causal mechanism. Next, there should be a set of assumptions. So these are the conditions that have to be in place for the theory to hold. Or you can also think about the conditions that might affect the strength of that causal relationship from X to Y. And then finally, ideally, you should also document the available evidence and whether it supports the theory or suggests that the assumptions are going to hold in your program context. So that could be internally generated evidence, for example, coming from your monitoring system, or externally generated. So maybe say from an evaluation from a similar program in a similar context. And yeah, results chains can, capture more complex causal logics involving multiple pathways. So for example, if you think, both V and W are necessary for X, you might have a relationship that looks like this. So just a note on this. The diagram might also be saying if V or W, then X. So where you have multiple pathways, the diagram itself is, not necessarily always clear about whether it's an and relationship or an or relationship. So that's maybe something, for example, that you might want to clarify in that document that underpins the results chain. So yeah, just in case that all sounds a bit theoretical, let me just illustrate that with an example. So let's suppose we've got a results chain for a women's economic empowerment program. And let's say we have this causal relationship in the results chain. So this is saying if there is an increase in income or enterprise growth for women-owned enterprises, then moving up, we will see increased women's economic empowerment for female entrepreneurs. So the theory or the hypothesis as to why we think this will happen might look something like this. So you might look at, what mechanisms might exist around increasing women's sense of self-worth and confidence, how that might change, household decision-making power, increase their financial autonomy, and so forth. So that's what your theory might be rooted in. Then you can think about, well, what are the assumptions or conditions that have to be in place for our theory to hold? So, for example, you might say that for that to hold, women have to have a means of retaining or controlling their income. For example, they've got savings accounts in their own name rather than their husband's names, let's say. And the gender social norms are not too restrictive or rigid. And you can then start to think about, what kind of evidence you might have that will support or maybe not the theory and the assumptions. So, for example, maybe you've done some focus group discussions, or maybe you've done some social norm studies that look at prevailing norms and how rigid they are. Maybe there's external evidence, etc. So just to give you a feel of what this actually might look like in practice. And just finally on this section, as this is a DCED webinar, I should probably say something about the DCED standard. So I'm sure most of you probably know what the DCED standard is. It's designed to be a practical framework really designed for private sector development programs to help them monitor progress towards their objectives. And intervention level results chains really are the foundation of the DCED standard. So just a quote from the standard itself. It says the underlying requirement of the standard is for program managers to think through and validate the logic of their work. So the first step is for managers to articulate the results chain, a simple yet powerful tool which maps the activities conducted by the project and shows how these are expected to contribute to positive development impacts. So that's what the foundation, the DCD standard says. So related to that, there's various control points around results chains. So the first one is around having results chains in place for each of your interventions. This point two, we've just talked about in terms of then underpinning those results chains, thinking through the theory, assumptions, and evidence. And then, points 3 and 4 kind of then get more into the use of results chains. And that's something that we'll come to in the next couple of sections. So that's a very quick run through on just the basics of results chains. Let me pause there in case, there's any questions.
If you've got more questions, you can put in the Q&A. Gareth, we had one particular question that came in, which you did speak a bit about, which was the distinction between intervention and sector results chains. Like, how do they compare? Why have both? And whether the intervention results chain inform the sector results chain? If you could just say a bit on that as well, please.
Yeah, no, great question. Yeah, so if I just go back quickly. Yeah, so this is an example of the sector results chain. So what this does, because often when programs intervene in a particular, if they're organized around particular economic sectors or agricultural sectors, as this one was, there might be kind of multiple kind of things you're trying to do to improve performance in that sector. So in this example, they were working in the maize sector and they had 4 different interventions in this. So what they wanted to do through the sector results chain is just show at a kind of higher level of granularity just what those 4 different intervention results chains are, the main kind of market system change that they were trying to bring about in the sector, and then ultimately how they come together. And we'll talk a little bit about, the use of these and why they're useful. But basically, it's, as you can see, it's a good way to show kind of complementarity, synergies between your different interventions in a sector. You might even, it doesn't necessarily come through here, but you can start to show the sequencing. And maybe there's, you want to get the public-private collaboration in place first before you move on to the next one, so you can start to show some of the sequencing. But as we said, this is kind of you can think of a kind of, the Russian doll. So this might be at a fairly high level of aggregation. But then what you might want to do for each of these 4 interventions is then develop an intervention results chain. So there'll be a separate results chain for each of these. So you'd end up with then 4 individual intervention level results chains. And what that does is just lets you go into more granular detail. So you can start to unpack a little bit about, disaggregate some of those changes, give a little bit more detail on the pathways. But yes, absolutely, it should kind of be aligned with this overall sector results chain. So you should start to see some, alignment and be able to kind of read across. And we'll come back to how you can, a tool you can use to kind of make that happen in practice in a few slides.
Can I ask one more question as a follow-up, Gareth? Like, I think it
Yeah.
was a good example when you explained through the Russian doll example. But I see like most programs, let's say they have a theory of change. And I think the next step is your sector level change and then your intervention level sort of chain, right? So what's the process? Like, I think, like, do you start from a theory of change and work backwards? Do you start from a sector chain and then go backwards towards intervention? Like, what comes first? I think that's That's one of the things that we see most often with programs. Like programs would definitely have a theory of change, a sector level change, but sometimes not intervention level changes, or the
Yeah.
other way around. So what's the best way to think about it?
Yeah, I've generally seen, so I'm speaking to kind of, yeah, market systems programs, but I guess any private sector development program where you're organized around particular sectors. So often you'll start off in your inception phase and you'll do some kind of market systems analysis or value chain analysis. That will give you an idea of the key constraints. And out of that, you would then have kind of interventions addressing each of those key constraints in the sector. So once you've got that, you can kind of start to construct what you think your sector level results chain looks like. And then you can get into the more detailed thinking through, exactly who you're going to start working with, exactly what your activities are going to look like. So that level of detail, it's just too busy if you're trying to capture all of that in your sector results chain. So that's why you might then want to go down into intervention results chains. But then obviously, once you start to do your intervention results chains, you might start to think, oh, well, actually, we got something in the sector level wrong. So, you might start at the sector level, go down to the intervention level, but there may be some iteration and back and forth. And we'll get into that a little bit in terms of adaptive management. So these should be kind of live tools. So once you get into it, there's a kind of back and forth around that. Let me, if it's okay, Manib, I'll move on
That's
just
very fine.
so I keep on time. Great. Thanks for the questions. Yeah. So let's look at why use results chains. So yeah, let's have a look at a different, let's do a different poll. And it would, yeah, be great to hear from you about how you use results chains in your work. So yeah, it might be to, as an aid in the design of intervention strategies. You might use it as a kind of communication tool. You might use it, as we've seen, around your monitoring, evaluation, and learning, maybe around your implementation. Um, if there's another way you use it, it'd be great to hear that. Maybe just write it in the chat, or maybe you don't use them at all. Yeah, and yeah, tick as many as apply. Just give people, what do you think we need? 20 seconds?
Just a
Finish
bit.
up?
Yeah. They can choose more than one option on this one.
Yeah. I think some chats are coming through as well. So we might have some others.
Yeah. Uh, Sorry, Lawrence. Maybe you could use the chat box to answer. The options are the same as what you have in in on Garrett's screen. But with this, I'll just close the poll for now. Yeah.
Fantastic. Oh yeah, super. So yeah, well, this is exactly going to be the point on the next slide. Yeah, it's really useful kind of across your whole project spectrum. Often it because it's the way people come to results chains, it's often through the DCD standard, which is a lot around the MEL. So, you know, often, well, sometimes people just think it's a kind of MEL tool. But yeah, as we'll see, and to be fair, this is what the standard also emphasizes. It's also a fantastic design and adaptive management tool as well. So it's great to see people using it, yeah, across the spectrum. All right, fantastic. Yeah, so yeah, there's really kind of three main use cases. So yeah, as we've said, one is an aid during the design of your projects and interventions. Second is a foundation for your MEL. And then finally is around implementation and adaptive management. And I guess the other thing to say is it's not just for use in market systems development or private sector development programs. So it is particularly useful if you are working in that kind of programming. So especially if you're working in market systems development, because you tend to have much longer kind of causal chain. Having results chains is particularly useful. But yeah, really anyone can use them and derive value from them. So yeah, let's run through some of these use cases, starting with design. Yeah, so I think an extremely useful tool in the design of your interventions. So it can help you check the logic of your intervention. So in my experience, it's very easy to write a long document where you describe your strategy and it all seems to make sense. But it's really only when you start to actually try and draw the results chain that you can really set out and interrogate the logic. And often by doing that, you throw up things you've not thought of, or it reveals kind of gaps in your thinking. By thinking through each of those causal linkages, it provides a really good process for systematically identifying your assumptions and also risks. I also find it really useful for thinking through the kind of gender and inclusion strategy. So once you've drafted your results chain, you can interrogate it from the perspective of different target groups, so such as women or rural populations, and think about whether each linkage is still plausible and whether those key assumptions are likely to hold. And finally, great way to communicate the strategy, hopefully in one simple diagram. We'll get back to that point. And also, it's a great way of bringing together, your intervention team, your MEL team, maybe senior management, and really creating that shared understanding within the program. So just to illustrate some of those points. So if we consider again our previous example, so we've set out the theory and the assumptions. So having done that, you can then systematically identify what the risks are for each of the causal linkages. So these might be risks that some of those assumptions you set out don't actually hold. So maybe because of external changes to the project context, for example, or risks that maybe, you could think of alternative causal mechanisms that might actually cause harm. So for example, you might find, that, for some women, there may even be a risk of backlash or gender-based violence resulting from increased financial success or autonomy. And then setting out those detailed theories, assumptions, and risks then also helps you really interrogate the intervention strategy. So, for example, if you're worried that for some women and in some areas where you're working, those assumptions might not hold, then that might lead you to think about, well, maybe, are there other interventions that we need to implement alongside? So, for example, do we need to do something to increase women's access to savings products? So they do have, that financial or autonomy. Or maybe we even have to try and think, can we directly tackle some of those restrictive social norms that may, prevent that theory from holding? Going back to that great question earlier around kind of, sector to level, why would you want to do that? So as we've said, also helpful, for just thinking through at that kind of higher level, as we were saying, how do those different interventions within your sector fit together? What are the complementarities? What are the synergies? How are you going to sequence these? And then if you do get down to doing, partner level results chains, so within a given intervention, you might be working with, let's say, 3 or 4 different financial service providers, for example. Maybe there's nuances across those, exactly what you're doing with those different partners. So you can start to think that through and show those nuances at the partner level. Second use case is all around MEL. So results chains really provide a foundation, as we were saying, for the monitoring and evaluation of your interventions. So yeah, by drafting the results chain, I mean, what you're doing is detailing the specific impacts you hope to see and the causal changes you need to get there. So that then gives you a fantastic framework for thinking through what you need to measure. So, as recommended in the DCED standard, ideally you should be developing at least one relevant indicator for each change in your results chain. So broadly, what you want is for your indicators to tell you, I mean, first of all, very simply, did the change as described in the results chain actually happen or not? Then, what was the depth of that change? And also maybe what was the breadth or the scale of that change? So how many actors are changing, for example, or how many farmers are benefiting? Yeah, you might also think about, if you've got key assumptions that you want to monitor, developing indicators that will help you track those kind of context indicators. Yeah, and then this lets you, if you're monitoring change in each of those boxes, that then really helps you to prove and improve results and impact. So if you've not kind of heard these terms before, so prove is all about the kind of accountability and reporting side of MEL. So how do you demonstrate in a credible way to your donors and funders the results you're achieving? And then improve is really about the learning and the adaptive management side of things. So yeah, on the prove side, if you are measuring change in each box and doing that all the way up the results chain, this helps you to build a kind of contribution narrative. So this allows you to describe the causal chain. So from your activities, all those different changes that happen all the way up to impact. So you've really got that detailed contribution narrative that you can demonstrate. On the improve side, if you're measuring each box, then this really allows you to test the logic of your intervention. And if you find that you don't get the results that you expect, you should be able to pinpoint where the logic is breaking down. So we'll come back to this in a couple of slides. So this really is the big advantage of results chain-based MEL systems versus if you just have programs that really only have an overall program log frame. So if you're doing kind of complex PSD, MSD projects, you've got multiple sectors, all sorts of different interventions. If you only have a log frame, you typically find they're just not granular enough to really give you the detailed information you need to kind of prove and improve effectively. So to do all that, yeah, you need to measure each box as we've said, but also, yeah, test your assumptions and interrogate why each change happened or didn't happen. Yeah, just finally on the MEL, thinking about the L part, yeah, I think results chains are also a really useful way of framing your program learning. So I do find, yeah, often when you read kind of lessons learned sections of program reports, they do sometimes read as quite superficial and kind of platitudinous, kind of obvious stuff. So yeah, I think good practice is, if you want to generate real learning, really be proactive about learning, you should try and document a set of learning questions at the start of your intervention. And your results chains, yeah, give you a great framework for doing so. So for each link in the results chain, if you've gone through and documented your theory, your assumptions and evidence, you can go back and look at, are there any areas where you're not quite sure about the theory, or maybe you've looked into the evidence and maybe the evidence base is weak or contested. And you then might craft learning questions that you want to answer as you implement the intervention. So just going back to our earlier example that we were using, you might have learning questions such as this. So for example, you might ask, does that causal relationships still hold in more conservative regions of the country. So, for example, I've done a lot of work in Nigeria, and the social norms in the south are very different to the kind of gender social norms in the north. So one thing you might want to learn is, does this causal pathway you've set out in your results chain, does that actually hold across those different regions of the country, for example? And then that's something you might set out to investigate. All right, just quickly, I'm just rattling through just to try and keep on time. Yeah, so the third use case is then all around implementation. Yeah, so results chains, once you get into actually implementing, I think, again, a really fantastic tool for tracking and managing your interventions, pinpointing any problems, as we've said, communicating progress. They're a great way if you do intervention level kind of progress reviews or strategy reviews. Results chains and those learning questions are a great way to frame those sessions. Or, as we were saying, if you've got sector level results chains, that's always then also a great way to frame those sector level review sessions. Yeah, and then really provides a foundation for adaptive management. So, yeah, one thing I found really useful during those kind of intervention review sessions is to adopt a kind of red, amber, green color coding system. So, yeah, once your implementation starts and your data starts coming in from your MEL system, you can start to synthesize that data, maybe adding in observations from your team, and really assess whether each box is on track, which would be green, off track would be red, and then somewhere in between is the amber. And then I think this provides just a really great visual summary of your intervention progress. And if you have any amber or red boxes, then you can immediately see where the logic is breaking down. You can then start to, in your sessions, in your review sessions, start to discuss why this might be so, looking into the data you've got, but maybe you need to go out and collect more data. So is it that your causal theory was wrong? Or maybe, as we were saying, maybe your assumptions aren't holding in practice, or maybe they're holding in some regions and not others. Yeah, and then that should then inform your decision making. So if your logic is not working, maybe you need to go back and change your activities, or yeah, maybe even exit the intervention entirely. And yeah, once you get up into the outcome and impact level, you can also repeat that exercise from the perspective of different target groups. So, for example, from the perspective of male-owned enterprises, you might find the boxes, are all green, it's all working fine. But for women-owned enterprises, maybe when you redo the analysis, maybe there's boxes that are kind of amber or red. So that might lead you to then interrogate why. So maybe women-owned enterprises are encountering certain access barriers, for example, that men aren't, and that's causing a blockage somewhere in the logic. And again, that then feeds back into your activities and strategy. Great. Any questions on that, on the use cases and why use them?
We got a few coming through, and I've been answering some of them myself, Gareth, but I'll just push some towards you. There are some things which I know you're covering later in the session, so I'll park those for now.
Okay.
One important thing that came through was that are results then really used for systems program, MSD programs, or could programs with direct delivery also use them? Like, what would that look like? Is it useful? And I think related to it, there was a question which I think you get to when it comes to how do you operationalize a MEL system with results chains. Is there like frontline staff, especially with direct delivery programs, they're usually disconnected with program objectives. So is it not for those kind of programs? Like, what would you recommend, and what has been your experience?
Yeah, sure. I mean, most of my experience comes in market systems development. But yeah, I think, if you think about what results chains are trying to do, it's saying, you should try and really think about what the logic of your intervention is, ultimately what you're trying to achieve. So that's your impact boxes. What are your activities? And there's still, even in a direct, if it's more of a direct delivery program, there might be certain changes, let's say, capacity and knowledge changes you want to see in your end beneficiaries before you start to see their behavior changes. So there still might be a logic that you want to think through. And then certainly, again, there'll be those assumptions that you need to think about. So it gives you a good frame for that. So I would suggest that results chains are still useful in that context. It might just be that your results chains you'll find that they might just be shorter than, for example, in market systems programs, just because there's different levels of change and different actors that you have to map out in market systems programming. So yeah, hopefully that answers your question. But yeah, I think also that point you were saying about maybe frontline staff being disconnected, maybe that's actually, again, a use of the results chains, because then hopefully it illustrates to them how it is that their activities they're doing down here, what is the ultimate purpose? How does that fit into the ultimate objectives? So maybe that is useful as well.
And I think there was a question, and maybe I could also speak to my experience on this one. Usually, when you think about results chain and visualizing change for an intervention, a typical MSD intervention or a PSD intervention also looks at, systems change elements or like keeping an eye out for those things through results chains. I think with humanitarian programs, direct delivery, sometimes that's not what they're looking out for. So I think a comment was in there, like, is that something results chains help them to like, look towards or have their eyes towards? And what I have seen in my experience that even if you're doing direct delivery, there is a change in the system. Sometimes people are just more aware of a new type of product being introduced in an
Mm.
area or like, just consuming things for the first time. So it does create a systems effect. So in that case, I have found results chains quite useful, but I see how they're being used vary from program to program. So, but like you just said, Gareth, I think sometimes the line of changes in a direct delivery program are shorter with not enough
Yeah,
actors, but still helps you to think through your measurement plan. Like I think that's next step of like what are you trying to track uh,
yeah,
really helps. Uh,
yeah, for sure.
one more question that I would just like push towards you now, Gareth, before we go to the next one, is on coming back to that point of like steps of changes, right? So you've got results chains for intervention, sector, and theory of change. There was a question on like in your experience, have you ever, reviewed a program's results chains, and when you're looking at intervention level changes, gone back to the theory of change and said like maybe the theory of change needs to be adapted. So related to that point of adaptive management, could you go back to, let's say, back to the drawing board when it comes back to the theory of change because you're seeing things work out differently in an
Yeah, for sure. Yeah, and that's a great question. Yeah, and yeah, that's exactly the point we were saying about this kind of interplay between those different levels. And yeah, definitely you can apply what we've just talked about around, adaptive management. Does your overall theory of change at the program level still hold? Does it need to change? So yeah, absolutely. Because theories of change tend to be at a higher level and they're less granular, they do, I guess, tend to not change as much. Just because, those more detailed changes they just don't show up in a overall program theory of change. But for sure, especially if you're in a kind of dynamic environment, or we've seen changes of funding, for example, might need to cut certain things, add certain things, etc. So that would definitely, yeah, then be feeding through into the program theory of change. Great. Let me move on, just in the interest of time. But yeah, well, hopefully we'll manage to answer all the questions as well. We'll have a final kind of question session, Q&A session. Yeah, so just on getting in now more to the practicalities of how to construct results chains. So in terms of, very practically the who and the when. So I think the key thing in terms of the who is, it's important not to see results change just as the job of the MEL team. So really they're best kind of co-developed and reviewed by the MEL team and the intervention team. So the MEL team often, has good expertise in how to develop results chains, but it's really going to be the intervention team who know the ins and outs of the intervention. And really you need both of those teams to be familiar with the results chains and really have kind of co-ownership of those results chains. In terms of when, I would say, good to start early in the design process. So, because as we've said, they're really helpful for intervention teams to, help them organize and clarify their initial thoughts, maybe identify any knowledge gaps, and so on. So starting early in that design process, it's just a useful way of, thinking through, organizing your initial thinking. From a MEL perspective, you definitely want, given if it's going to be the foundation of your MEL for the intervention, you definitely want them to be in place before you start implementing. And then once you get going, you want to, as we've been saying, reviewing regularly. So probably at a minimum every 6 months, but certainly nothing stopping people doing it more frequently than that even. So really important here to not see the results chain as kind of set in stone. So you regularly review your results chain and change it as your strategy evolves. So we've had some questions around kind of structuring your results chains. So let me go into that for a couple of slides. So we know that you're going to, at the bottom, have kind of boxes around activities, and at the top, you'll have your ultimate development impact. So in between, often programs use a strategic framework, or it can be called, other things, but a kind of high-level framework that describes the different level of changes that the causal pathways will pass through. So this can really help teams, I find, when drafting a new results chain, rather than starting with just a completely blank page, which can be quite intimidating. And as we were saying, this can then really help provide consistency kind of across your interventions, but also that alignment. So you can use the same strategic framework to structure your theory of change, then your sector level results chains, then your intervention level results chains. So they'll all have that same level. And then, as we were saying, that helps the consistency and that read across. So just to illustrate what that looks like so I've done a lot of work with financial sector development programs. So this is the strategic framework that they use. So at the bottom, we've got your activities. So this is what the program does. Then the next level is market system change. So all the boxes at this level describe any changes by market actors. So that might be financial institutions doing something different. It might be regulators, central bank, etc. Anything that they start to do differently gets captured at that level. Then the next level is for financial outcomes. So for these programs, this was around change in access and usage of financial services by individuals and enterprises. And then you have your development impact. So as I was saying, they were using this strategic framework on the left to structure their overall program theory of change, but also, all the way down to their intervention results chain. So all of them had these 4 same levels. Just for any people who are deep into their market systems, I know this often comes up and people argue about this. So you can definitely split out that first level. Some people like to have a kind of intermediate change level. So that's kind of initial changes you're seeing in capacities, incentive practices of market actors, and then you get the full market system change. Yeah, then let's think about now zooming in terms of, drafting your individual boxes and some good practice around that. Um, yeah, so really, if they're going to be useful to help teams to clarify and test the intervention logic and to give you that really good foundation for your MEL, you want each box in your results chain to be specific about the who and also the what. So at the impact level, this means you want to be clear about, which particular target groups you're expecting to benefit and what particular benefits are you hoping to see. So, is it increased income? Is it resilience? Is it jobs? Is it something else? Then at the midpoint, you want to be clear about, which market actors, for example, if you're a market systems development program, are adopting what practice changes or changing in what way. And yeah, this then really helps to clarify, if you do this, what exactly is your role, for example, as a facilitator versus what do you expect, the partners, your partners and market actors to be doing. So just to illustrate this, here's a results chain box. It says training delivered. Not a great box for a number of reasons. So first of all, not clear who is delivering the training. So as we're saying, is it the program going to do it? Is it more you're going to facilitate market actors to do it? Who is that training being delivered to? Who is that being delivered to? Not really clear what type of training is being delivered. So yeah, a box like that, not great. So something like this is better. So yeah, much more clarity on exactly who are you talking about, who's delivering it and to whom, and what's being delivered. Yeah, then thinking about how to put these boxes together into a flow. So starting from the bottom, the vertical flow from kind of one box up to the next should be logical and plausible. So change at one level should be necessary and sufficient if the assumptions hold to bring about change in the next level. So if a box is not necessary, then you probably could remove it. And if a box or set of boxes are not sufficient, then you need to add boxes. Otherwise, you're not going to get that change you need. You can also think about, the causal linkages or steps ideally shouldn't be too big. So you don't want to kind of miss important steps or too small, or even you definitely don't want it duplicative or overlapping, which can make the results chain unnecessarily complicated. And yeah, generally you want to avoid dead ends in the logic. So you want to be able to ideally build pathways all the way up to the impact level. Otherwise, the pathway, if it's just stopping kind of halfway, it's not necessary for the ultimate impact you're trying to achieve. All right. So yeah, I thought it would be fun to do a quick exercise. So Manib, I think, is going to drop a file for you into the chat, and it's going to look like this. So you should see that in the chat. It's a PowerPoint slide. So it's basically a jumbled up set of boxes for an intervention results chain. So just quickly to describe the intervention. So it's for a pilot phase, and the program is going to support a financial service provider to develop a new collateral-free digital loan product, specifically for micro enterprises in the retail sector. And they're hoping that that is going to specifically reach women-owned enterprises. And as part of that model, the financial service provider is also going to provide embedded financial literacy training. So what we want you to do just in 10 minutes is to reorganize those boxes and see if you can create a logical results chain for the intervention. So we've put the strategic framework for this particular program on the left. That's the far left side. So you can use that to help you. You may not need every box. If you've got time, you can start to add in those arrows to show the logical flow. And I know some of you are very experienced, those people who rated themselves a 4 and a 5. So if you whiz through this in 5 minutes and you have time, maybe you could even start to add and craft some of your own boxes to try and capture some of the sustainability and scale. We will be here to answer any questions that you have. And yeah, we'll go for 10 minutes and then we'll go through a kind of suggested answer.
Great. Till then, if everybody could just confirm that they have been able to download the file. If somebody has still not received it, they could just message in the chat and we can share it again. And if the exercise is clear, okay, perfect.
Yeah. If anyone is really having trouble doing the exercise, maybe go and make a coffee and you can skip the exercise and we'll carry on in kind of five past.
And while people are working on this, Gareth, maybe if I could just like ping some more questions at you, which you could just speak towards. I think one question that keeps on coming is the distinction. I think it's a distinction between theory of change, results chains, log frames. So which tool to use when and what's most effective at different stages. And then I think related to that one, for let's say when we spoke about sector level results chain and a results chain, which is intervention specific, the levels we talk about, like you have activity, output, outcome, and then for an intervention, it's usually the same typical ones, activity, output, outcome, impact, sector level, right? But at a sector level results chain, what would the steps be? Like, what would those categories be? Like, is there guidance towards it, or does that really depend on the program?
Yeah. All right. Shall I take those now, do you think? Or are you
If it
going to
doesn't
distract
distract
people?
you from the exercise, maybe right after the exercise, you could just have them with you.
Yeah. Or okay. I could also save them for the final Q&A as well. Yeah.
I think a typical one, Gareth, as well, because there has been request for sample results chain sort of frameworks or like tools so that people could get started. So the one that you're sharing in an exercise is a very simplified version of it. So I think in the real world, you usually wouldn't get something this simple. But maybe after the session, we could share some examples of results chains. I mean, there are some within the DCED guideline as well, but I think we can still share like a sample of different results chains.
Yeah, for sure. And we'll send around the slides so you can go back and look at those ones we put at the the start. But yeah, maybe Manib, we could compile
Yeah.
a few others that we can share as well from maybe a few different programs.
Mhm.
I think on the website as well, perhaps, is it Beam? Is Beam the best place to go to for examples?
I would say Beam has quite a few in the evidence framework side of
Yeah.
things. Um, but I think maybe there's a need to compile like one section which has just sample results chains for different things because sometimes you just have to find them a little bit. So that's
Mhm.
something that I take on internally and share.
Yeah.
I think there's a question here which says, could you please clarify how you have considered the market system change between activities and outcomes?
Yes, great. I thought that question might come up. So we were using this strategic framework. So yes, this is so the results chain you're using is an example of a real intervention from one of these financial sector deepening programs in Africa. It's been simplified a little bit. Yeah, and this is the overall strategic framework they were using. So yeah, let me leave this up, and then this should help you think about what goes at different levels. So yeah, activity levels. So that's anything describing what the program does. Yeah, for this program, they had the market system change level. They used that to talk about anything that market actors were doing differently in terms of, so market actors, they were thinking about, for example, financial service providers, regulators, etc. So for this exercise, anything where the financial service provider is starting to do something different would be at that market system change level. Then for them, they said, what's the switch from there to then financial outcomes? So this is where you're thinking about the access and usage of financial services by those particular either individuals or enterprises they were trying to reach. So in our case, we're particularly interested in micro retailers. So any boxes related to them accessing and using new financial services, for example, would come at that level. So it's a great question, and I'll leave this up because it might help people. Should we go for another minute, do you think, Minnie?
Let's give it what do we think in the chat? Like, are we close to done? Yeah, maybe
Let us
maybe not
know how
enough.
you're getting on in the chat, and we'll see how we're doing for time.
Yeah. Okay, some confirmations, but let's just give it a minute.
Yeah, and as I say, if you have managed to reorganize the boxes, if you want to have a go at thinking about sustainability and scale, which is not captured at the moment, you could even have a go at drafting your own boxes for that.
I think, Gareth, we could proceed.
Right. All right. Let me go back to this. Fantastic. So this is, yeah, what you were given. So here's our kind of suggested answers. So yeah, activities. We've got these two boxes here. So note all the boxes at this level detail, what the program does. So you'll see they start with program supports, or it might say program delivers, or whatever it might be. Then at the market system change level, we've got these two pathways. So one is where the financial service provider develops that new product and the app and the scoring system. And there's also this pathway which looks at the sales team and that kind of embedded financial literacy training. So yeah, as we said, all the boxes at this level are detailing changes by the financial service provider. Then we've got those things come together at the financial outcomes level. So boxes here detail the changes in the access and usage of financial services on the demand side. So yeah, now looking at the micro retailers. And then we've got the ultimate impact. So yeah, that's suggested kind of answer. Yeah, I mean, don't worry too much about if you had things slightly at a different level, and there can be kind of gray areas as well. So yeah, don't worry if you've got things, slightly different levels. I think as long as you've got the basic flow, that's great. And yeah, here was the red herring, capacity increased that we didn't use. So firstly, it's not really a very well crafted box, as we were saying. So not very specific. For example, whose capacity are we talking about? Is it increased capacity of the financial service provider, of the sales team, of the micro retailers? So it's just not clear who we're talking about. And yeah, not necessary in the logic. So yeah, we didn't use that one. For people who, you may have got onto thinking about sustainability and scale. Yeah, so that's just in a couple of slides, look at that. So yeah, for programs that are following the market systems development approach, or even if you're not, but you aspire to sustainability and scale, which hopefully all of us do, you really want your intervention results chains to include boxes and pathways that show how that sustainability and scale is actually going to come about. So just on the terminology, because I know sustainability can get used in different ways. So here we mean the continuation of the practice changes and the impacts beyond the end of the intervention. So yeah, you need to think about, what's the triggers that are going to promote sustainability and catalyze either internal scale up by your partners or maybe external replication by other organizations or actors that maybe you've not worked with or worked with so intensively. Some replication might happen organically, so it happens by itself within the market system. But yeah, you can also start to think about any additional activities you need to promote replication. And you can also start to organize your results chains into kind of vertical planes to kind of break up and capture, what it is you're trying to do in the pilot phase, what it is you're trying to do in the scale up phase. And for anyone who uses AAER, you can also incorporate, adopt, adapt, expand, and respond boxes in your results chains. So yeah, here's what it might look like for our practice intervention. So yeah, this first box captures the sustainability and the internal scale. So yeah, financial service providers, typically are commercial enterprises. They're often quite risk adverse. So for them to sustain and scale up the pilot, the net returns and risks are going to have to be sufficient for them to do so. And that's only going to happen once a sufficient number of micro retailers have accessed and repaid the loans. And then that then provides the trigger. If you're seeing that, then you might also then start to see other FSPs replicate the model. So some of that might happen by itself. So that's what this results chain is saying. But there might be things that you want to do as a program to try and encourage that. So you can start to then build out some of your scale up activities. So, for example, you might develop and disseminate a case study that really shows the business case of this particular financial product, disseminate that across the industry to try and really encourage that replication. Yeah, and then as I said, you can. I've seen some programs do this, and I think so the idea is you basically create these kind of vertical planes, and then you build out the logic. So this is what we're trying to achieve in the pilot phase. This is what we're trying to achieve in the scale up phase. So again, that's a great way to kind of help you think through the phasing of your interventions. I will skip this slide in the interests of time and this one. Yeah, so, oops. Yeah, so it would be great to, just hear from you about, some of the limitations of results chains or challenges you've encountered. So those people who are, more experienced, the 3, 4s and 5s, it would be great to hear from you, as you've used results chains in your work, have you found any limitations with that? Have you noticed any challenges maybe that you've encountered or your colleagues? If you're more of a 1 or a 2 on that scale and it's your first time, what did you find kind of challenging about the exercise? Or if you think about trying to use results chains in your program, do you anticipate any challenges? So yeah, I think, is it right in the chat, Manib?
So yes, I'll just encourage everyone to write in the chat for their challenges. And while you're thinking through them, maybe Gareth, I could kick things off and maybe pose a question to you.
Yeah,
Um,
that would be great.
so I think when it comes to operationalizing results chains, like you just mentioned, it's not just the responsibility of Mel, but also implementation managers. But then I
Yeah,
think especially these days, you see a lot of lean programs in terms of resources. They don't have like a lot of staff. Um, Not saying specifically for Mel, but just generally, you see very lean structures, and especially when you see private sector MSD type of programs, they usually monitored through their partners. So how do you use results chains then? Is it more of an internal tool for us to measure? Because building the capacity of, let's say, your partners to use it as well is usually difficult to get across.
yeah.
So what's your experience been with that, like of these lean monitoring when you're relying on other people to send you information as well?
Yeah, for sure. Yeah, and I suppose there's a distinction between implementing partners who are basically an extension of you, because I know partners can be a confusing term, and sometimes people use it. For example, if you've got a consortium delivering a program, and you might have other organizations that are kind of an extension of you, essentially. So more implementing partners, or it could be partners, more market actors, like in the previous example, financial service providers that you're partnering with. Yeah, so I think if you're talking about implementing partners, I think, definitely good to get them involved in, especially if they're responsible for delivering all or part of the intervention, having them co-develop the results chain and own that results chain and being familiar with that and the monitoring that goes on with around that. And again, as we were saying in the use cases, I think that's a really useful way to make sure everyone's on the same page and are clear on the objectives, etc. In terms of if you're talking about more market actor partners, I think there's differing views. I know programs definitely do kind of co-develop it with
Yeah.
partners. In my view, I'm always a bit hesitant about trying to turn, say, commercial actors into development actors.
Yeah.
So I tend to err on the side of caution about expecting them to get too involved in some of these kind of tools that are really mainly for us.
Mhm.
But people definitely have different views on that one.
Great. And I think more sort of reactions now coming through, Gareth, so I'll ping a few towards you again. I think one of the challenges they say, like with results chains, sometimes it feels like a box ticking exercise. So I think
Aha.
To that, I think you've spoken a bit about like the use case, right? So it's not really
Yeah,
just a visual tool, but on that. So some people say like the challenge we've had is some people might just think it's a box ticking thing.
yeah,
Others have also said like results chains have been used at the proposal stage, and then the
yeah.
staff finds it too complicated and don't use it in implementation. And I think
Hmm.
it kind of links to the third reaction as well, which is on adaptation.
Yeah.
So they say like, so you can adapt results chains based on changes that you see, but then sometimes like what is too much adaptation, right? Like how often do you adapt? Sometimes you're like too set in stone about donors' expectations. So even though you would want to adapt, you're unwilling to because you think like the donor needs to see that change. So
Hmm.
there's a bit of this trade-off between like, do we make those changes now that we see, or do we stick
Yeah,
by achieving the goal that we're planning to get towards? So is it like
yeah,
a
yeah,
goal tracing exercise, or is it more of a management and measurement exercise? I think that's the other one. Maybe
yeah.
you can take
Fantastic.
both and see more reactions.
Yeah, I think those are great. Yeah, and yeah, let me run through the next set of slides, and it goes through kind of from my perspective. I think there's kind of three main challenges or limitations that you see, and yeah, it's yeah, very interesting to hear. I think it's chiming with a lot of what people are saying. So let me yeah, fantastic. Let me go through the slides. Um, yeah, I think probably the first thing to say is that results chains are more of an art than a science. So there is a lot of subjectivity involved, and there's different choices that you can make. And it also takes a lot of practice, I think, to get good at producing results chains that really have good utility. Um, yeah, so on my experience, yeah, I think yeah, there are kind of three kind of main pitfalls and challenges. So I think the first one is that the standard kind of results chain tool is a bit of a blank slate. So this has one big advantage in that it's a very flexible tool that can be applied, really by any program and for any type of intervention, as we've been talking about. But I also think this has, yeah, a number of downsides. So it can result in wildly different kind of approaches to constructing results chains. And yeah, I myself, I've been using them for kind of, yeah, as I said, over 10 years. And over that time, I've, yeah, gone really back and forth over the best way to construct results chains. Um, yeah, and then I think because of that, the quality and therefore the utility of results chains can really vary significantly across programs. And I think when you are faced with that blank slate, it can be difficult for people to, just know where to start and what to include. So even among kind of experienced practitioners, there are different views as to whether, for example, should you capture all the changes in capacity and knowledge and incentives of an actor, or just is it just the practice change, for example? And yeah, the results chain tool in itself doesn't really contain any underlying conceptual model of how change happens. So I think this makes them kind of less useful as they could be in really helping teams, think through how change actually happens and to, kind of systematically identify those assumptions. So I think linked to that first point, and I think this was, yeah, coming up a bit in the chat. I think the second challenge, yeah, is how to manage the balance between kind of simplicity and complexity. So is it better to have something that captures all of the complexity and feedback loops and all of the interactions? So more like on the left-hand side of this picture, or is it something, should you aim for something that's much more simple and linear and really strips away a lot of that complexity, like on the right? And yeah, I myself, yeah, really, I've gone back and forth myself over kind of what level of detail to include. Yeah, common questions I get when I do training, how many boxes should a results chain have? Is there an upper limit? Also, this question on, should you just do results chains at the intervention level, or should you also be doing kind of partner level results chains? Obviously, if you do partner level results chains, you can capture, as we were saying, that nuance of each individual partnership, but you obviously end up with lots more results chains. Yeah, so there's obviously advantages of and disadvantages to weigh up. So if you've got more complex results chains with more boxes, you can capture all the detail and the nuance. But yeah, if you've got results chains with lots of boxes, I think, as someone said, can become, confusing for the teams, then becomes less useful as a management tool and a communication tool, and then people stop using them, as someone said in the chat. And also, yeah, it can just, if it's too complex, you can just overwhelm the MEL system. So as we said, and as the DCED standard recommends, you're supposed to have at least one indicator for each box in the results chain. But if you've got really complex results chains, you end up with lots and lots of indicators, and you can just overwhelm the MEL system. And then obviously the opposite is true for less complex results chains. So yeah, let me just give you a real world example, and I'll return to this results chain that I flashed at the start. So this is a real results chain from a market development program in Africa. So the results chain has 39 boxes. This was one of 7 interventions that the program was doing in the livestock sector, and the program was working in 6 sectors. And the MEL team had dutifully developed indicators for each box in the results chain, sometimes 2 or 3 indicators. So when I came in as a MEL advisor halfway through the program, I found the MEL team were just completely overwhelmed. And they literally, because their results chains were so complex and they had so many of them, they literally were trying to monitor hundreds and hundreds of different indicators. So, what is the right balance? I think there's no right or wrong answer, and it depends on a number of things. So one is just the kind of level of familiarity with results chains in the team. So if you and your team are kind of new to results chains, you should probably try and keep things simple at the start. I think as the question came in, and as you were saying, Mani, also depends a bit on the resourcing. Obviously, if you've only got a small MEL team, for example, you might want to, stick to more simple intervention level results chains, or maybe relax that requirement to, have indicators for every box and just focus on some of the key ones. Yeah, and even within the program, different people within your team might have different needs. So in that previous example, the portfolio manager who came up with that results chain really liked that level of detail because it really helped him think through all the different changes and sequencing and a lot of the detail. But yeah, as I said, for the MEL team, it was just too much. So, there can be different views. Yeah, having said that, I think there are some things that all programs can do to try and reduce unnecessary complexity. So do try and focus on the key elements of the change process. So I think the DCED standard, advises you don't have to capture everything in your results chain, every little detail, but you should be able to convince what they call a skeptical but reasonable outside observer of the logic of your intervention. So again, that's more of an art than a science, but it gives you a kind of rule of thumb, maybe. Once you've drafted your results chain, step back. Is there a chance to maybe consolidate boxes that are very similar? Are there some areas of duplication or redundancy? So boxes you can just kind of take out. Yeah, then the final challenge or pitfall. Really, this is much more about the operationalization and use. So I think someone said exactly this about results chains being seen as a box ticking or compliance exercise. So these are some of the symptoms. Yeah, so you get the results chains just developed at the end of the design phase just to meet, the project approval requirements. Then they just sit on the shelf and not actively used. Not regularly reviewed and updated, so it gets set in stone, maybe siloed in the MEL team. So obviously, if this is happening, then some of those great benefits we talked about around the use cases aren't going to happen. So yeah, I guess tips to overcome this. Yeah, I think, yeah, once you do have it, and it does come back to that complexity, simplicity. Partly why they don't get used is because they're too complex. So if that's the case, just simplify them, because there's no point having a really complex one that no one uses. I think another great way is, yeah, try and get in the habit of doing, say, quarterly or 6 monthly review sessions and really use the results chain as a kind of framing for that. So go back to the results chain. This is what we set out. This is what we thought happened. This is what actually happened. Use that RAG rating, as I said. And it is a really great tool. And it does mean that, they then get actively used and then hopefully reviewed and updated as well. So not set in stone. And you can bring in the MEL team to do that, the intervention teams. So hopefully they're not getting siloed as well. That is the end. Yeah, is there any questions on that? I know we're out of time, so I might, or Munib will confer in a second whether we can offer a 15-minute bonus session to people who are interested. But yeah, that's the bulk of the content. Are there any questions on that? While people are writing any final questions, let me come back to some of those earlier ones. I think there was one around theories and theory of change and log frame, right? So yeah, program level theory of change. So that's, your one diagram covering your whole program. So obviously that's going to be much less detailed. It will really set out your overall objectives, what you're trying to achieve, and broadly the areas in which you're going to intervene. So for example, for the financial sector development programs I work with, a lot of them have developed these kind of pillars. So they have kind of 4 pillars. So one is around innovation, around working with financial service providers to innovate around new products. One might be around regulation, working with regulators and policymakers. One might be around financial infrastructure, etc. So it's at a very high level. And then the log frame, I think there was a question about that. So again, that is at the program level. And ideally, that should be linked to your theory of change. So each of those boxes in your program level theory of change should then have an indicator in your log frame, which is how you'll measure at a high level, are you achieving those changes? So the log frame tends to get linked to the theory of change. So that's what that looks like. And then lower down, the lower level of granularity is where you have intervention level results chains. And again, they'll have additional indicators. And that's where you're going beyond the log frame. So you might be crafting additional indicators. But obviously, what you measure at the intervention level, you want to be able to aggregate up. So you will want to use some of those common log frame indicators, even at that intervention level, to make sure you can aggregate. So that's how that all fits together. The other one was, level of detail and sector versus, I think, intervention level. Yeah, so again, it's just about getting more and more granular. Sector level results change, typically at the bottom level, instead of saying kind of activities, they often say interventions, and all they will say is, let's say, hybrid seeds intervention. So it will just give that level of detail saying, essentially, it's just saying we are going to have an intervention in this area. But it won't, for example, have 3 or 4 boxes that detail the specific activities. So that level of detail will only be in the intervention level results chain. But as I said, if you've got that strategic framework, you can use that across your sector level results chain, your intervention level results chain. There was a good question, I think, around guidance on sector level results chains, which is a good question because, I think with the DCED standard, it's fantastic, but it does jump straight to intervention level results chains. So I think what is missing is this piece, and I think it's coming through in all the questions in terms of that hierarchy of theories of change and results change, how do all those things fit together? And how do you make sure they align? And that guidance doesn't exist in the DCD standard. And I don't think I've seen great guidance. Manib, don't know if you have.
Uh,
Um,
So I think there's more sort of work coming through about what sector level results chains are, or how do you see more at aggregating different results together. But we don't have particular guidance of putting it together. Maybe as a first step, because Gareth, we do see a lot of people looking for examples of this. Maybe you and I could just brainstorm examples of, let's say, interventions and just showing three templates saying like this intervention is going to sector and this goes to theory of change. So it
yeah,
shows a consistency. Maybe more than a guidance, an example of what it looks like would be the first step, and we could work from there. So yeah, that I would be happy to share that with the group here.
yeah, fantastic.
And I know that we're over time, so I'm just
Yeah,
I feel like we have a very good segment as the next one, especially for people who are somewhat familiar with results chain as the next step that Gareth has been working on. So it is quite useful if people can stay, but even if you cannot, it's completely fine. I think we can take 10 more minutes if that's okay. We will be recording this and sharing it with everyone. But if you could just hold on for 10 more minutes, I can promise you that's quite useful for you to stay and see this new approach towards results chains. Gareth was
great. Yeah, and yeah, thanks everyone who yeah needs to drop off. Fantastic to have so many people, and great you could join. Yeah, for people, diehard results change enthusiasts who are still with us, and if you can spare 10 minutes, yeah, I'll just share something that I've been working on around new approaches um, to results chains. So yeah, it's based on the COM-B model of behavior change that some of you might be familiar with. So developed by Susan Michie and others back in 2011. And I've put the source down there below if you're interested in that. And in the next slide, I'll explain a little bit more about what it is. Um, but yeah, what I basically have done is taken their basic model of behavior change, this COM-B model, and basically integrated it into the structure of results chains. So yeah, the aim is really to address some of those pitfalls and challenges that we were discussing earlier, particularly those first two about, how do you manage the complexity? How do you know what to include and what not to include? How do you make it not such of a blank slate for people? How do you give a little bit more structure for teams so it's not so difficult? So yeah, let me just run through what it looks like. So yeah, Michi and others set out this COM-B model. So they took inspiration from the kind of original crafting of the US criminal justice system, which I think was documented, back in the 19th century or something. So the system in the US says that, for someone to be found guilty of a crime, it must be demonstrated that they had the capability to commit the crime. They had the opportunity to commit the crime, and they also had the motivation to commit the crime. So Michi and co. turned this into a kind of general conceptual model of behavior change. So they developed this model in the context of preventative healthcare. So they were kind of looking at behavior change in patients. So that's kind of where they were coming from. So for PSD programming, I've kind of added another box, another kind of element of the basic model, which is around performance. So hence COM-BP. So there's an extra P. So you can see, yeah, on the left-hand side, that's a kind of description of what's at the different levels. And yeah, that source paper goes through. It's quite kind of robust about, what goes under each of those levels. So it's a great resource. So just to make it a bit more real for PSD programming. So here's an illustrative example. Let's say we're thinking about smallholder farmers. So that's the kind of actor that we're interested in. And, the starting point might be, done some very initial analysis. If we're, let's say, an agriculture program, and we're looking at the performance of a typical smallholder farmer, say in the maize sector, and we might find, for example, in terms of performance, they have low yields, produce low quality produce, and they learn low incomes. So then moving down, the idea is that we can use COM-B to then explain, this low level of performance that we're seeing. So what is it in terms of their behaviors and practices that explain this low level of performance? So, for example, it might be smallholder farmers tend to use traditional agricultural practices. They make limited use of agri-inputs and technologies, etc. And then moving down, why is it that they've are exhibiting these particular behaviors or practices? You should then be able to explain why that is in terms of either their capabilities, opportunities, and motivations. So, for example, in terms of capabilities, maybe they don't have sufficient knowledge of good agricultural practices. They don't know how to correctly use agri-inputs. In terms of opportunities, maybe they're in remote areas and they don't have the opportunity to buy agri-inputs. Or there's no opportunity to get access to information. In terms of motivations, they might be quite risk averse, so they don't want to necessarily make big investments in agri-inputs or equipment, especially if they're not sure it's going to work. Or it might be around habits and kind of mindsets. They might be used to using kind of traditional agricultural practices and be reluctant to change. So yeah, the idea is in terms of, so how do you take that and construct a results chain? The idea is you can use that kind of basic COM-BP model to start to build out results chains for our intervention. So let's say, for example, we want to work with market actor X, that's in the green, to change their behaviors and performance. In order to ultimately change the behaviors and performance of market actor Y. So those might be our end beneficiaries, our farmers. And then we might want to, to improve their performance, we might say, well, first of all, we need to change the behaviors and performance of, let's say, agri-input suppliers or agro dealers in order to make them, help them better serve farmers. And then that then creates the change in farmers. And obviously, then down at the activity level, that's right down at the bottom in the orange, this then sets out, so what are our activities that are going to catalyze either the change in the CORM that gives us the change in the behaviors that then cascade up, through to those other actors in the model, in the chain. And obviously you can add more actors or less actors. If you're direct delivery, you might only have the orange and the green. If you're in a more complex intervention where there's multiple actors that need to be influenced, you might have 3 or 4 different types of actors. So this might sound a bit conceptual and might look even more complicated when you first see it. So let me talk you through an example of what this might actually look like. And hopefully through that, you'll start to see how it really helps structure your thinking. So let's say we've got an intervention designed to support agri-input suppliers to adopt a new mini packets distribution model. So the ultimate aim is to see an increase in the correct and repeat usage of agri-inputs by smallholder farmers. So what might the COM-BP chain look like? So it might look something like this. So starting with these blue boxes, so these are the agri-input suppliers that we're going to partner with. So if you look at the change in behavior in that box, that is just describing what behavior or practice change do we want these agri-input suppliers to adopt as part of this intervention. So in this case, it's that we want these agri-input suppliers to pilot. Initially, we want them to pilot the mini packets for smallholder farmers, recruit preferred stockists who are going to sell these mini packets, and we want the suppliers to provide embedded information to the stockists, because the stockists will then have to pass it on to the farmers. We then want to see the suppliers scale up the model. So that's the second kind of behavior change that we want to see. So for the suppliers, we then need to think, so what is the performance change we hope to see for suppliers as a result of this behavior change? So we might say, we think if they adopt this model, that's going to increase their sales, because they're now going to reach, this big untapped market of smallholder farmers, and we're going to see some repeat sales as well. So that's going to increase profitability. Then you need to think about, so how is this change actually going to come about? So, for example, you might have done some diagnostics, talked to some agri-input suppliers, done some kind of, will-skill analysis, and you might find, for example, that suppliers currently don't have the know-how to develop the model. So there's some kind of capacity barrier. So therefore, we might think, okay, we need to overcome that capability barrier. So maybe we're going to need to provide technical assistance to these suppliers to give them the necessary, know-how to develop the model. So that's going to be the initial change in capability. But then you might think also over time, maybe their capability is going to increase by itself through learning by doing. So you're starting to get feedback loops. So once they start to do that practice change, they start to actually pilot the model. Hopefully they're going to actually learn something as they do that. So that's going to create kind of another level of capacity change, capability change. You also might have, through your diagnostics, speaking to suppliers, they might have told you, well, we don't really see smallholder farmers as a viable market segment. We're happy supplying larger commercial farms. So then again, you need to think about, so how are we going to overcome that motivational barrier? So initially, you might say, well, we're going to give some cost sharing to our partner firms that's going to give them the initial motivation to at least test this model. But then obviously, that's, for it to be sustained, there's got to be a permanent shift in their motivations. So how is that going to come about? So that's captured through that feedback loop on the right-hand side. So if they do adopt the model and they do see that increased performance, they do start to see increased sales and increased profitability, that then is going to give that feedback loop, what we call proof of concept, and is then going to further improve their motivations. So hopefully that illustrates, through that COM-BP model, it really helps you think through, what is the behavior change we want to see? What's the performance change that's going to be needed for them to sustain? And how is that change actually going to come about? What are the barriers? Is it capability, opportunity, motivations? And then how are our activities actually going to overcome those barriers? And then there's, as we said, there's a chain. So we know, if we get all those changes going with the suppliers, we now know at the very bottom, those suppliers are now going to be providing mini packets, stockist training, and an incentive scheme to now the next level in that kind of supply chain, which is the agri-input retailers and stockists. So then you can just go through exactly the same thought process. So what's the behavior change we want to see in those stockists? So in this case, they start to stock and sell the mini packets and provide that embedded information. What is going to be their performance change? Because they're also going to need to see some benefit. So that's going to give sustainability at that level. And also, what's the barriers, and how is what the suppliers are doing down at the bottom of the chain, how is what they do actually going to change the stockists' capabilities, opportunities, or motivations? And then finally, going up, you've got the smallholder farmers. So that's the ultimate group we wanted to reach. And again, it's exactly the same thought process. So the change in practices we want to see is that they start to buy the agri inputs, the mini packets, and adopt the new agricultural practices. What is their increase in performance? We care about that because that is important for us, for our impact. So we hope that because they buy these agri inputs and adopt the improved practices, they're getting increased yields, quality, and increased incomes. But again, that's important for sustainability at that level, because otherwise they're not going to, if they don't get those benefits, they're not going to repeat the purchases. And again, it's also, thinking through, is there a clear chain that says, from what we've done with the suppliers that feeds through to the stockists, does that then overcome the capability, opportunity, and motivational barriers that we know exist in smallholder farmers? I won't talk through it as well, but we've kind of constructed the COM-BP chain upwards, but you can also construct it sideways. So you can use exactly the same idea to think about how does scale up happen. So for example, in terms of, let's say we've got this practice change among our partner agri-input suppliers, how do you then see practice change, behavior change among other non-program supported agri-input suppliers? So again, you can start to think through what are those change mechanisms, how do you overcome their capabilities and motivations? If the program isn't directly providing TA or cost sharing, is there an organic pathway that is going to overcome the other actors in the market, their capabilities and motivations? So, for example, it might be through a demonstration effect. They might be able to reverse engineer, or I've often seen especially in financial sector, development programs, often a kind of pathway around replication is just poaching of staff. So you see other banks, poach the staff of partner banks. So that can be a kind of pathway as well, and so on and so forth. I won't go through it, but yeah, hopefully you can see what that might look like. And yeah, we'll send out the slides so you can have a look. Yeah, so that's it. Yeah, and just in terms of just to summarize in the last 30 seconds, the benefits that I see of this. Yeah, so giving more structure. It's not a blank page. You have these kind of COM-BP units that you kind of can work with and fill in, but hopefully it doesn't just become a box ticking, because hopefully you can see there is quite a lot of thinking that is involved. How exactly, what exactly is the behavior change we want to see, and exactly how is that going to happen? How are we going to overcome, let's say, the motivational barriers that might exist? And it should also help then people think through the assumptions, because to adopt a practice change, any actor does need the capability and the opportunity and the motivation. So either those exist already, so you're assuming those exist already, so those become your assumptions, or if they don't exist, then you're going to have to do something to change them. So it also helps you think through those assumptions as well. So yeah, let me stop there. We probably, and I don't know how many people are left at this point. Oh, we've still got 38 people. Yeah, I don't know if there's any questions on that, or also it'd be great to drop into the chat if anyone has seen other alternatives to that kind of typical results chain that we kind of ran through in the main presentation. That would be fantastic, I think, to share with the group. And we could also then email it out to our colleagues that were on the call earlier and dropped out. So yeah, it'd be great to hear about that in the chat.
Yeah, thanks, Gareth. And we will send a feedback form. So we would give an opportunity for people if they want to share some relevant material related to this. Thank you so much for everyone who stayed through with this. I think it was quite helpful. Thank you especially to Gareth for taking out the time and doing this presentation, and Ella also working in the backgrounds, making sure everything worked perfectly. I'm just going to leave one link in the chat, which is for the next webinar that's coming up, which is on effective monitoring, evaluation, and learning for MST programs in fragile contexts. Um, I know we really ran over time, so sped up with it quite a bit. But yes, I see comments already, Gareth, about the COMB framework. So stay tuned for that. We will share something related to it as well. With that, I will just bring the webinar now to a close. Thank you so much for your participation. This has been a really engaging conversation. Thank you.
Thanks, everyone.
Cheers.
Thanks, Manib, and yeah, to the DCED for organizing.
Thank you. Bye.